Hi. Good morning, everybody. Just by way of explanation, I'm here with Dr. Marianne Gale, who is the Deputy Chief Health Officer, and also Zoe Robinson, who is the Advocate for Children and Young People. And in addition, we're honoured to have Alyssa Horan, who is a Year 9 student and is part of the advisory group to the Advocate for Children and Young People. Well, the good news is vaccinations, one dose in New South Wales have reached 82.5%, and two doses we're now at 53%. So I just want to thank everybody who's coming out in great numbers to make sure that all of us right across our community are kept safe. Tests to 8 p.m. last night, there were 121,661 tests. So again, I want to thank the entire community. It's just amazing how our state, our community have come out and been tested day after day after day. So thank you so much. Locally acquired cases to 8 p.m. last night, 1,022 cases. So slightly more than yesterday, but still well down on the peak numbers that we had about a week ago. The cases predominantly are still in Western Sydney and southwestern Sydney, but we also have very high vaccination rates in southwestern Sydney and Western Sydney. And I just want to thank everybody in Western Sydney and southwestern Sydney for coming out and getting obviously vaccinated in vast numbers, and that is obviously starting to make a real difference for us. So, but more broadly across the state, everybody's been doing that, so thank you so much. Sadly, to 8 p.m. last night, we had 10 people pass away. There were 8 men and 2 women who passed away. One person was in their 50s, one person was in their 60s, 2 people were in their 70s, 5 were in their 80s, and 1 person in the 90s. And I just want to say to their family and friends my very great sympathy to each and every one of you. It's when you have someone from your family or a friend pass away, it certainly is one of the worst moments, I think, in our lives. So to each and every one of those families and friends, my condolences and sympathy and condolences on behalf of New South Wales Health as well. Lockdowns. Unfortunately, we've had some cases in the northern part of the state, in Tweed and Byron Bay and Kempsey. And so there will be lockdown arrangements entered into from 5 p.m. this afternoon in each of those local government areas. I have actually spoken with the local members of Parliament and other community leaders, and there's a general understanding of the need for those lockdowns, but it will be initially for 7 days, and it'll be reviewed. Public Health will be out encouraging, obviously, testing. And I certainly, as Health Minister, encourage everybody in those areas to take this very seriously. So far, those areas have been kept relatively safe, but we need the community to keep getting tested so that the public health team can be very, very certain of what we need to do at the expiration of those 7 days. So please go out and get tested, and go and get vaccinated, obviously. Get vaccinated. Vaccinations in those northern areas, Kempsey, Byron Bay, Tweed, it's crucial that you go and get vaccinated. Let's make sure that everybody across our state has the benefit of being safe for themselves, for their family and their friends. What I would, I'm quite excited to be able to talk about today is the Young People's Friends Bubble. There's been a lot of work done. The Advocate for Children and Young People themselves, families generally, have been obviously finding it challenging that young people have not been able to have their friends over. And we know that mental health is a huge issue in this ongoing and certainly dragging on pandemic. So I'm absolutely delighted that Crisis Cabinet has accepted the proposition that because our vaccination rates have now reached such a high level, that it's now acceptable for a limited number of young people to be able to come to one of their friends' houses and to be able to stay there and to do what young people want to do. And Alyssa will tell us a bit more about that and how it might have impacted on her and other young people. But so it'll basically be you can have the same two young people coming over to one person, and so that's a bubble of three effectively that will be the friendship group that can be in the house. Of course, not forgetting that we do have the 5 people, children or adults or what have you, outside as well. So there are, the larger numbers have been possible outside for quite a while, but this will allow young people to have those friendship groups inside their home. But I emphasise that it must be, we've got to be balanced about this, it must be in households where the adults are all double vaccinated. So that's a critical issue. We've got to keep our young people as safe as we can. We've got to recognise the need for mental health to be recognised and just socialisation, all those things that young people do as part of their growing up, but also keep them safe. So to the parents out there, please make sure that the children that are coming from another household, parents or the adults in that household are doubly vaccinated, and you are doubly vaccinated. I know as a parent myself, we all have an obligation always when we have young people come over to our houses. It's a case of we want to make sure they're safe and well cared for. In an epidemic, that is obviously an issue. So make sure that you are doubly vaccinated, please. I'm going to ask Dr. Gale to provide some more health information. Then I'll ask Zoe Robinson to give her perspective as the advocate for children and young people. And then we'll be honoured with some comments from Alyssa. I just indicate to my journalistic colleagues here that Alyssa has never appeared before TV cameras before or any other issue, so please just understand that she's not experienced in doing this sort of thing, but she wants to have her say, so please acknowledge that in the way that you address her. Okay, to Marianne Gale. Thank you.
Thank you, Minister, and good morning, everybody. In the 24 hours till 8 p.m. last night, there were 1,022 locally acquired cases of COVID-19 in New South Wales and 1 overseas case. As the Minister said, we continue to see good testing numbers, and thank you for people for coming forward when you have symptoms and even the mildest of symptoms. So more than 120,000 tests reported till 8 p.m. last night. Currently in hospital, we have 1,266 people with COVID-19 admitted, 244 people in intensive care, and 118 people who are currently requiring ventilation support. Of those 244 people in ICU, 181 haven't been vaccinated, 54 people have received a first dose, and 9 people have had 2 doses of a COVID-19 vaccine. In terms of the suburbs of concern, similar to what we've been reporting in previous days, we continue to urge residents of the Western Sydney and South Western Sydney areas in particular to continue the great job that you've been doing in following public health advice, getting tested, getting vaccinated. And particularly I'd ask residents of Greenacre, Guildford, Bankstown, Revesby, Marylands, Fairfield, Liverpool, Condell Park, Auburn and Blacktown. In terms of sewage, we're having sewage detected in the Ballina and Wardell catchment areas of northern New South Wales local health district, and we currently are not aware of any cases in those areas. So for anybody who lives in those areas, please be vigilant for symptoms, please come forward for testing. I'd also like to take this opportunity to remind people who might be travelling from a stay-at-home area, an area under stay-at-home orders, to an area without stay-at-home orders for a reasonable excuse, that it's very important that you continue to follow those stay-at-home orders once you've left. So if you've travelled into, for example, a regional area that's not under stay-at-home orders, it's very important that you don't go out and about, and in particular that you wear a mask. So a big plea to anybody leaving a stay-at-home area to please follow that advice. In terms of the deaths that we're reporting today, as the Minister said, we're aware of 10 people who have passed away. 6 of those individuals were from southwestern Sydney, 1 person from Western Sydney, 1 person from southeastern Sydney, 1 was a resident of northern Sydney, and 1 person from Sydney's northwest area. Of the 10 individuals who sadly passed away, 6 were not vaccinated, 2 people had received 1 dose, and 2 people had received 2 doses of a COVID-19 vaccine. Among the 10 deaths that we're reporting today was a woman in her 90s from Western Sydney, who is sadly the 3rd death linked to an outbreak at the Hardy Guildford Aged Care Facility, and she sadly passed away at Westmead Hospital. Among the 10 are also a man in his 80s from Sydney's northwest who died at Hornsby Hospital, which is where he acquired his infection. And also among the 10 is a man in his 80s from southwestern Sydney who passed away at Concord Hospital and who acquired his infection at Canterbury Hospital. There have now been 255 COVID-19 related deaths in New South Wales since the 16th of June and 311 since the start of the pandemic. And on behalf of New South Wales Health, I extend my condolences to all the families of people who have lost their lives to COVID-19, and in particular to the families of those 10 people that we are reporting today. So I'll end my comments there, and I'll pass on to Zoe.
Thank you and good morning. Thank you, Minister Hazzard, and thank you, Dr. Gale. I too would like to extend condolences to the families who have lost loved ones. I also want to acknowledge the 2.5 million children and young people in New South Wales who are uniquely experiencing this pandemic. And I want to acknowledge the work that has been happening across government to ensure that the voice of children and young people is heard throughout this process. My role as the New South Wales Advocate for Children and Young People is an independent role, and our job is to bring the voice of all children and young people to government, business and community, and no more important than at this time right now. So I want to acknowledge some of the great work that's going on, and especially the announcement today around this friends bubble. That is as a direct result of what children and young people have been saying, that they want to be able to see their friends, they want to be able to do it safely, and the reason they want to do that is for their own wellness and because they've really felt the isolation during this period of time. And this gives them an opportunity to connect, to care for each other, to see each other in ways that they have been unable to do. So I really want to acknowledge New South Wales Health, the Minister for Education for this work, and the Premier for listening to children and young people at this time, and the great work that's going on across government that is directly informed by children and young people. But excitingly today, you don't just hear from adults, you have an opportunity to hear from a young person herself who's experienced this pandemic. So please, I'd like to introduce Alyssa to share some of her thoughts around the pandemic.
Thank you, Zoe. I'm Alyssa and I'm in Year 9 at the moment. I'm 15 years old and I know that lockdown has been incredibly hard for everyone lately. However, children and young people definitely want to do the right thing and also be able to socialise because lockdown is incredibly isolating for everyone. Helping everyone feel connected will undoubtedly benefit their mental health in this time. And for children and young people, this will also be able to impact their studies because I know from personal experience that there is a lot of lack of motivation regarding schooling due to lockdown and not being able to see our friends. Children and young people at the moment want to do the right thing, but we also want to stay connected. Therefore, being able to socialise whilst also abide by the new rules through this friendship travel bubble will definitely help us all greatly at the moment. Thank you.
Any questions to anybody? Alyssa, yeah, sure. Alyssa, you're more popular than me.
You actually did a very good job there, better than the Health Minister. Well, firstly, can you tell us, from a personal level, how hard has it been for you to not see your friends, to have homeschooling for term 3? What's that been like for you?
Well, of course, it's been very difficult not being able to socialise in person because Zoom and FaceTime can only do so much to keep you connected in times like these, which is why I think this new travel bubble will really help improve everyone's mental health and also hopefully their schooling regarding motivation. at the moment. So it's been quite difficult, but through support networks and feeling connected through Zoom, it's definitely been made easier.
And Alyssa, how have you found learning from home all of this extended period and doing so much on Zoom and online with your classes?
Of course, it's difficult being on the screens all the time, but utilising support networks and the facilities that the school provides has definitely been helpful. I'm lucky enough to have a great school program at the moment, but I know a lot of people might not be so fortunate to have home learning as effective as what I have at the moment, but definitely it's doing pretty well at the moment, yes.
What's the conversation like between you and your friends about getting vaccinated? Have you been talking about getting vaccinated and whether you want to do it and whether have you been talking about that amongst yourselves?
Personally, I know everyone's very excited to be vaccinated around me. I am double vaccinated at the moment, which is a great relief to know that I'm protected transitioning into going back to school and seeing people again. And I'm aware that all of my friends and family are also quite excited to be able to get vaccinated and feel safe going back into the community.
Thank you.
How about that? I think to have young people like that is just amazing. And to think that our community is going to have her probably and her friends in charge at some point. Amazing, fantastic. Sorry. Ash.
Lisa, were there any health concerns with allowing, so many unvaccinated young people going into households at
Of course there were. But I mean, it's a balancing act. We're in an epidemic and everything has to be a balance. The strict epidemiological views would be we all should stay somewhere away from everybody else forever. But the mental health issue